Okay, and here we go. Welcome everybody to The Big Idea. Today we're going to be showing you an interesting observation that I've been making with a few people who experience essentially symptoms that are like Meniere's disease. If you're not familiar with it, Meniere's is a condition where people will experience transient vertigo attacks. There's going to be like a fullness or a ringing kind of sensation in the ears, and also difficulties hearing. And based on all of the stuff that's out there, there's really not been able to identify a certain factor that causes it. And in the same breath, it looks like people do experience certain amounts of relief with certain types of medication, trying to eliminate alcohol, salt, caffeine, stimulants, things like that from the diet, but also where people do experience relief by basically releasing some of the tension that can exist in a person's neck. And of late, we've had a few people come into the practice, and we've made a very interesting observation on a couple of their diagnostic scans, things that are not being diagnosed under general circumstances. And it's kind of making me wonder, might there be an underlying explanation for what's going on? Now, I'm not going to say we're going to be drawing grand conclusions based on just a couple of observations, but I do want to show some of the stuff that we're seeing on our imaging that might correlate with some of these symptoms, so that if you or somebody you know has been dealing with this and has had certain kinds of tests, this might be something that's worth looking into. So let's jump into it. Okay, now what I've got here for you is what's known as the tegmen tympani. Probably never heard that word. I had to look up the word for it as well. But what I've got here for you guys first, so illustration, so you can see the ear, you can see the outer ear, and then here's the area where we're going to be talking about the the middle ear, and then the inner ear right through here. So points of reference, you've got the eustachian tube, so that is allowing your ears to come up to equilibrium with pressure changes. You've got then these little bones right here, so these are the guys that are going to vibrate when we hear sound stimulations. This spiral looking thing that we have right here, that's the cochlea, so that's the hearing organ. And then these little loopity things right here, these are what are called the semicircular canals. They are, when we're moving our head, what's responsible for balance equilibrium, and if they're ever disrupted, that is a probable cause of vertigo. And what I want to illustrate in this little diagram here is that you have all of this stuff right here. So this is the bone that is going to separate the inner ear from the rest of the cranial vault. And what I want you to take notice of is that the bone fully encapsulates the, well, not the external auditory canal, but the tympanic cavity right through here, and then also should form a ridge, a protective layer from all of the rest of the brain right here. And this particular part of bone is what's known as a tegmen tympani. Now, the image that I have over here on the right side, this is what's known as a cone beam CT or a cone beam X-ray. This is not the type of CT that's done in the big tube where it involves a lot of ionizing radiation, but also relatively thick slices. These are very, very thin slices and very low dose radiation. We use this to assess conditions that are going on in the upper part of the neck, but we can also see what's going on with some of the cranial features as well. So points of reference, this would be the left side over here. This is nothing more than the person's jaw that you can see in a little side profile. But you'll take note that there's this black circle right here with this white dot that's in the middle, and then this kind of white jumbled mess circular feature that you would see right here. So the little dot that you see in the middle of the black space, those are the ossicles. So those are the little bones. This white circly thing right here, those are going to be the semicircular canals. And I want you to pay attention that even though it is very, very thin, that there is a small layer of bone, so this whitish stuff that you see that actually envelops these structures, again, separating the middle and the inner ear from the rest of the cranial vault. So this would be an example of a normal image. Now, we've had a few people who have come into the practice and they've had long-standing Meniere's-like symptoms. So again, this is not just vertigo. This is a combination of coming and going vertigo, but also hearing issues as well. And what we're seeing on these people's scans, if this is the normal right here, we're seeing again the normal bone that would be enveloping that cavity right there. That look right here. It's pretty much non-existent. So you still do have that protective layer of bone around the semicircular canal, but you don't have it around this area right here. Now, does this mean that fluid is necessarily leaking out of the middle ear and then into the cranial vault or vice versa? No. Because what you would also have, and you can't see this on a CT scan, but on the inside of the cranial vault, what you have is a layer of connective tissue that's called the dura. So think of it as a little membrane that is still going to separate these two fluid surfaces. Now, normally, if you have solid bone that separates the two of them, pressure changes that would happen in one will not affect what happens in the other. But if it turns out that that bone is congenitally thin, so it's just narrow for whatever reason, if you have just that membrane is actually subject to changes of fluid pressure, whether it is inside of the middle ear or if there are changes in fluid pressure inside of the cranial vault. And fluid pressures inside of the skull, those can be affected by a whole bunch of different things. Anything that's going to cause our blood pressure to go up or down, the way that we breathe. If there's a problem with fluid because things are simply put not working, not moving right in the upper part of the neck, that can affect blood flow to the brain, blood flow from the brain, but also the circulation of the cerebrospinal fluid inside of the brain. And I can't help but wonder that, if you don't have that bone right there, if you've got something that's affecting fluid levels and fluid pressures inside of the brain, is that possible that that starts to affect the pressures of the middle and as a consequence the inner ear that could account for both the hearing and also the vestibular systems? So this is one person that we've been seeing in our practice, and they've been doing well but not perfect. But we discovered, retrospectively, they have this weird little phenomenon going on. Now, by dumb luck, we had somebody who experiences very similar symptoms come in the very next day. So I had a look at him. And guess what? Same thing. So here's the normal. Again, that protective layer of bone, the tegmen tympani around the middle ear. And same thing, there is the protective layer of bone around the vestibular system, but not over the top of that system either. I did also have a look at a couple of other people that we have in our practice where they do not have any vestibular or any hearing issues whatsoever. And yep, they've got, kind of like just I showed you on that very first picture, they've got that solid ring of bone right here. But for those two people, just like that, who experience these Meniere's-like symptoms, they don't have that protective layer. So something interesting that you may want to have a look at if you're experiencing some of these symptoms. Now, I repeat what I said at the beginning part of this video. Am I going to be drawing grand inferences from a population of just two people? The short of it is absolutely not. But this has opened my eyes up to something that, you know what? We should probably look at this, because this might very well be an underdiagnosed reason why people are subject to Meniere. So we think that we're going to be doing some in-house research on this to see if there is an increased risk of people, if they have this defect in the bone of the middle ear, that they may be more likely to experience Meniere's. Now, of course, I wanted to make sure first that, okay, we don't have too many cockamamie ideas here. I'm certainly notorious for that. So we did what any responsible healthcare practitioner would be. That is, cross-check some of your findings first against ChatGPT. AI is very useful because it's the assembly, it's the conglomeration of huge amounts of ideas, huge amounts of databases and knowledge that is out there on a variety of topics. Now, we still need to be able to interpret it, and also the quality of the output is reflective of the quality of the question that we asked. But simply put, what I asked ChatGPT to say, okay, might there be some basis for some of these ideas? Is it possible that a defect of that bone, what kind of symptoms would typically manifest, and is there any research that's done to see if this could be linked with Meniere's disease? So here's what ChatGPT says. Number one, it confirms, and you can read this. This is the exact answer that it spat out for me. So the tegmen tympani, it's that bony roof over the middle ear that separates the middle part of the ear from inside of the skull. If it is thinned, dehiscent, which means that there's a gap in there, or fractured, CSF or brain tissue can herniate into the middle ear. Now, I need to qualify this a little bit, because again, that would seem to say, okay, that no, there wouldn't be really a connection. You'd be having all kinds of other issues. Remember what I said, that there is a difference between if you have a crack of the bone, and what ChatGPT is saying here is that it also has caused damage to that membrane. What I'm hypothesizing here is that there might be the bony defect, and under normal circumstances, you still have that membrane intact. But because you don't have the bone in place, that membrane is going to be subject to pressure changes, and pressure changes inside of the skull may have the propensity to affect pressure inside of the ear and inside of the canals as well. So they're talking about overt fracture and where you have leaking. I'm not talking about leaking. Now, hypothetically, what would the symptoms be if you had this kind of issue? Okay. Vertigo or imbalance, especially pressure or sound induced. Alternating hearing loss, where sometimes it seems to be because like something's blocking the ear, but other times because there is nerve damage. Tinnitus, oftentimes pulsatile, so that is as if the perception of you're hearing your heartbeat inside of your ear. CSF otorrhea, so this is fluid leaking out. Again, this presumes that the membrane has been ruptured. We are not talking about that. But also potential for infections or meningitis. Again, that presumes that that membrane has in fact been ruptured. So it goes on to say, and again, it's describing it in terms of overt damage, not just to the bone, but also to the membrane. So CSF leaks, fistula formations, or basically tumors. You would see all of these things on an MRI. And the report and the ultimate conclusion that they make is they say, okay, you have a difference between when you have this overt damage and suddenly you're dealing with a CSF leak. But no studies have actually looked at the defect itself with an intact membrane to see if that might be a risk factor for developing Meniere's disease. So this is basically just a little bit of a look here. This is an unexplored potential explanation for why people, they may go through life, and just because you might have this kind of bony defect, it doesn't guarantee that you would have symptoms, but it does mean that there could, and this is a possibility, this is a hypothesis, a smaller margin of error, so that if there is more inflammation in your body, if there is or are things that are changing fluid pressure inside of the skull, which caffeine, salt, sugar, stress, and also problems in the upper neck that are going to affect how that circulation can flow, these can all be factors that influence the internal pressure, which could in turn affect the pressure gradient across that membrane and may ultimately produce some of these vertigo or some of these hearing sensations that people report when they experience Meniere's. So as I am editing the video, I realized that the last part, so the overall summary, did not record the audio, so we will do it the brief version right here. Takeaways from this. Again, we can't draw any grand conclusions off of a population sample of just 2 people. That's not enough. But a couple of things that certainly, because there's not any research that's out there that's looking at this possibility for Meniere's disease. Number one is if you have been diagnosed by an ENT, by a neurologist, by somebody with those qualifications, it's worth having a look at your scans to see, might you have this potential risk factor that is involved? Or if you're experiencing these symptoms but have not yet had any tests, make sure then that as part of your assessment, you're looking to see, is there perhaps this defect of the window over the middle part of the, middle ear right there, that could, and again, it's a big could, be a major impact in terms of what is actually going on. Now, the question remains, well, what do we do about this? Because again, if it's a tiny little gap, there are surgical procedures that can help with that, what's called a dehiscence. But if we're talking about where the bone never developed and we have just this thin membrane that's covering over the top of it, that might be decidedly more complex, and really we're not 100% sure collectively what to do. Certainly still stay with the traditional treatments and approaches for helping Meniere's. So that is the low salt, paying attention to outdoor temperature, not having caffeine, not having alcohol, certain medications if it's appropriate, but then also, of course, other factors that affect the pressure gradients of fluid inside of the head. Upper cervical chiropractic, craniocervical therapy, all kinds of different things like that. And maybe, even though, the nature of Meniere's is it has been a mystery for well over 100 years now at this point, modern technology and insights, they might make the difference so that we know in the future this is exactly what can be done so that this is not an ongoing condition for so many people. So I do hope that you guys enjoyed this video, even my shaky little version here at the end. If you did, please do again, click that like, subscribe button. That way this video can be found by the algorithm so that other people are able to find this information. Also, if you've got friend, family member that you think would benefit, please share this video with them. And if you want some more information about the services we do in our practice, you can visit us at clearchirospokane.com. Videos, blog articles about all things related to upper neck, what can be done. Thanks again for watching. Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.